how does it feel to be a young patient and being seen with the lens of an older individual or treated in the same category? This is not to disrespect the age. It is just to say age is a way of individualizing how we talk, what we do, and what we should expect.
I would say that I've been very fortunate in my care team in that they have recognized that I am quite young, and not only am I facing the medical changes that are going to happen to my body, but there's the psychological long-term impact as well. A lot of times I feel like the doctors are very focused on saving our lives, and yes, that's their primary goal. But there's so much more beyond that when you have a younger population in survivorship. What else am I dealing with in my life? We're full-time career professionals at the time. How do we juggle work and life balance when life has flipped upside down on you? And I would say that one of the most important things, as you've said, is communication. For me, I was able to walk in very headstrong in knowing that I'm young and I'm very healthy other than the fact that I had cancer. And so I could go in and say, doctor, I want you to be as aggressive as possible. I know that I can bounce back. I know that I can survive this. You know, you don't have to worry about me making it through a surgery in the same manner that you would have to worry a 70, 80-year-old person. So let's go and tell me what my options are, and let's make a decision together. So one of the most important things that I started to do was find out how to speak this new language, doing the research of what are the drugs, what are my side effects, what's normal and what's unusual but still possible. And I really started getting into the community of finding out what drugs are available. You know, coming from the Eastern background, my parents said, well, try this and this. And I was like, well, slow down. I need to make sure that there aren't going to be any counterindications with any drugs that I'm taking. And so it really became a learning process for me as well as my oncologist. We had to learn together, I think, that whole process. So when it came to new drugs, you know, I already knew what was going on. I had been in the patient community to find out who's on this clinical trial, what is it worth it? What's your side effects? What's your quality of life? So, for example, when regorafenib came out available for colon cancer as an approved drug, my doctor suggested that that was a possibility when I had a recurrence, and I flat out said, no way. And he kind of looked at me kind of surprised, because usually I'm much more about, let's talk about this and what can I expect from it. But in this case, I already knew that the trade-off of quality of life versus the possibility of how much longer my life might be extended was not worth it for me. So we went on to next options, and that turned out to be surgical interventions.